the area of relapsing remitting MS is well served with an armamentarium of biologics given either by infusion or subcutaneously. My lab developed probably the first biologic that opened the field, a drug called Tysabri. There are oral drugs now that are highly efficacious. And I think that individuals with relapsing remitting MS, if they can get started early enough in the course of their illness, have a very optimistic outcome. I think one of the areas that is more challenging are the areas of progressive MS, particularly primary progressive. And there was a breakthrough a couple of years ago with one of the anti-CD20s, Ocrelizumab. And we'll see if the exciting results there can be improved with other anti-CD20s. But one of the bigger issues is getting efficacious medications to the niches, the locations where the immune system has taken residence within the brain and spinal cord. And I think looking at it mechanistically, this is perhaps the biggest challenge in stopping the immunological attack on the central nervous system. Then other areas of great importance, of course, are repairing the damage that's already occurred, getting the brain and spinal cord to do some effective remyelination. And I think that's another major frontier. The third area, of course, is understanding what this disease is all about. What is the initial trigger? Is it something like the Epstein-Barr virus that's associated with infectious mononucleosis? Is it other viruses? And then if we ever got a handle on what the cause was, we may be able to intervene exceptionally early by either stopping that immune response or even someday, as we did more than half a century ago with another central nervous system disease, polio, just stop the disease. So it's generally a historical footnote. So that's sort of the most optimistic picture of the future that needs to be solved. But there have been some enormous advances in the field, and the anti-CD20 drugs are right up there at the head of the pack of really showing us how effective monoclonal antibody therapy can be.